You're listening to Nurse Converse, presented by Nurse.org, a collaborative podcast amplifying diverse nurse voices. Get ready for a dose of inspiration, a sprinkle of education, and a whole lot of community.
Welcome to Nurse Converse podcast. This is your host, Ellaine Maala, also known as the Nurse Who Invests. And speaking of investing, today we're going to be talking about whether it is a good investment to go back to school as a nurse practitioner or not. And I get asked this question so many times. You have no idea. I think that in order for you to know whether something is a good investment or not, you need to weigh in the pros and cons of pursuing this career. So, whether you're a nursing student, a nurse, or just somebody who's contemplating for your future and considering a career change, then this episode may be for you. First of all, let's talk about how and when I became a nurse practitioner and why did I even pursue this career. I have been a nurse for over 6 years before I decided to become a nurse practitioner. And to be honest with you, I did not really contemplated on going back to school when I got in the nursing program, right? Like it's not one of those things where I told myself that I'm going to be a nurse practitioner right after I graduated as a nurse. I used to work as an ICU nurse, and it was this one night working in the neurosurgical ICU that I decided that I wanted to apply to nurse practitioner school. I was very busy. I had two of the sickest patients. And 2 weeks later, I did not even realize that I applied. And I told myself that maybe this is one of those things that I need to look into. So before I actually accepted that interview for this nurse practitioner school, I weighed in the pros and cons of going back to school as a nurse practitioner, because deciding whether you should go to graduate school to become a nurse practitioner or get your master's degree, this is a big decision, and you really need to know the advantages and the challenges of becoming one in order for you to see if this is something that is worth pursuing, right? Let's talk about advantages of becoming a nurse practitioner. The demand right now for nurse practitioners in our healthcare industry is on the rise. And this demand is driven by several factors, including the aging population, increasing healthcare needs, and the growing focus on preventative care. If you think about it, and I don't know if you've ever experienced this, sometimes it would take months to see a specialist or a doctor because of this increasing healthcare needs, right? And nurse practitioners play a vital role, not only in primary care, but even in specialized care, working with physicians in order to provide this care for people who needs it the most. So the job security for nurse practitioners is really excellent, right? The job outlook for nurse practitioners is excellent. There is a demand for nurse practitioners in the coming years. And that means that when you graduate as a nurse practitioner, you can have that opportunity to find a job right away. Of course, this is going to be very different in different states. But according to the US Bureau of Labor Statistics, the job outlook for nurse practitioners includes a 40% growth by 2031. And this means that there's about 118,600 jobs that will need to be filled at this time. That's a lot, in my opinion. So you have some sort of job security if you pursue becoming a nurse practitioner. I think that you just need to really look for these places that really looks for nurse practitioners and having this profession as an in-demand career. Second advantage of being a nurse practitioner, which I have experienced myself, is an increase in salary. And there is a really great article at Nurse.org where it shows nurse practitioner salaries by state. And according to this article, nurse practitioners can earn an average salary of $121,610. And that is also according to the US Bureau of Labor and Statistics. I know that you're probably thinking that, oh, Ellaine, that is not the case, for where I'm at. This is going to vary state by state. And that is why this article is really great, because it actually shows the annual mean salary of each state. And it's really going to differ. In this article, it says that the highest paying states for nurse practitioners is California. That's where I'm at. And New Jersey, Massachusetts, Oregon, and Nevada. So if you live in any of those states, like, it's a good thing to look into being a nurse practitioner if this is something that you want to do to increase your salary. Number 3 is that nurse practitioners have a greater level of autonomy in their practice compared to registered nurses or nurses in general. And this means that you really get to have a say in your patient's care. You make the decisions, you prescribe medications, you order diagnostic tests, and it really gives you a sense of professional independence. I work in a pulmonary and sleep medicine clinic, and I work with 3 pulmonologists. And I can say that with experience, I have really gotten, some sort of autonomy in my practice, because I'm able to think for myself on how I want to care for my patients. And of course, like, there are things that you need to consult with your attending physician, and things that needs to be discussed in a team setting. That way you can do a collaborative treatment for your patients. With that said, being a nurse practitioner also has an advantage where you can work in different specialties. I have worked in family medicine, I've worked in urgent care, and I know that there are some nurse practitioners who work in specialized cares like oncology, endocrinology, and rheumatology. So this flexibility really allows you to find a specialty that aligns with your interests. And that, I think, is a really great thing when it comes to becoming a nurse practitioner. Those are some of the perks that I like about being a nurse practitioner. Of course, like, with every job or career, there's going to be ups and downs. So it's also important that you look into the challenges that you may face as a nurse practitioner. And one of them is that you're going to be taking out student loans of some sort when you go back to school. So this going back to school is an educational investment by itself, right? Becoming a nurse practitioner requires a master's or doctorate degree, and it can also take years. So, whether you decide if it's something for yourself, then you have to also keep in mind the financial and educational investment that you have to put into pursuing this profession. When I was a nurse, I thought that I was going to be able to work full time and go to school full time, but that wasn't the case. I ended up doing per diem nursing on my second year in my nurse practitioner school, just because it's very time consuming and it requires me to go into this different clinical rotations, and just doing full-time working and full-time studying is just not something that's sustainable for me at that time. And so the second challenge of becoming a nurse practitioner is your income potential as a nurse is going to be decreased. You're going to be giving up that full-time nursing salary while you go back to school. And it's really going to impact how you have that work-life balance. So I did this back when I did not even have kids yet, right? This is even harder for those of you who probably already have kids that you take care of, or if you have a family. So having a really great support system is probably one of those things that you need if this is something that you want to pursue. On top of that, you're probably going to take out some student loans of some sort when you go back to school as a nurse practitioner. And a lot of people may not be open to taking out debt if they have, like, other debt that they are already paying while they're a nurse, right? So those are some of the challenges. The other thing is that the working conditions for some nurse practitioners is not ideal for some people. I remember when I was a new grad, nurse practitioner, on my first job as a family practice nurse practitioner, I was seeing so many patients. So there may be a high patient ratio when you work as a new grad, especially if you work in primary care. I was seeing 20 to 30 patients a day. And this is very difficult, especially if you are working in a specialty, not even a specialty, like family practice, where you are expected to know all these things about your patient and you having to see this many patients in one day, right? So I switched to urgent care thinking that it may be better for me, but I ended up seeing like 70 to 100 patients. It wasn't until I went into specialty nurse practitioner role that I decided that this is one of my best investments in life. So it may take a while for you to really find that place, that specialty, that working schedule that works for you as a nurse practitioner. And I know that we've kind of mentioned in one of the advantages of becoming a nurse practitioner that you're going to have autonomy and independence. So, with that said, your legal responsibilities can also increase just because you're more responsible for your patient's medical decision making, right? And right now in our profession, everybody is getting burnt out with all this policies and expectations in the workplace when you're a nurse practitioner. So that's something that you also have to keep in mind. There's a lot of factors that you have to consider whether you should pursue nurse practitioner school or not. And I think at the end of the day, it really depends on what your personal and professional goals are. And if you value job security, if you want to increase your salary and you really want to have that opportunity to make a real impact or like difference in your patients' lives, then maybe becoming a nurse practitioner is something that you need to look into. But at the same time, keep in mind that you will be decreasing your income potential as a nurse. You may have to take out student loans in order for you to go back to school. And having a support system is really crucial in order for you to be successful in pursuing this career. For me, being a nurse practitioner, I always say this in all of my social media. It has been one of the best investments I ever made in my career. And the reasoning for that is because now that I am a mom, I find that my schedule as a pulmonary nurse practitioner has worked really well for me. And I no longer work weekends and holidays. This is really great for me as a mom. But keep in mind, though, that like what I said, I initially worked as a family medicine and urgent care nurse practitioner, and it took me maybe 3 years to find a specialty that works for my lifestyle. With all this said, you can still have this work life balance as a nurse. It's just a matter of knowing what your long term goals are in your career or in your personal life, right? As a wrap up for today's episode, it is clear that becoming a nurse practitioner could be a very rewarding and challenging career path, but I want you to really weigh in the pros and cons in considering what your personal and professional goals are when it comes to deciding if this is worth it or not. Like, it's the same thing with any kind of investments that you do in your life. You have to weigh in the pros and cons of this in order for you to make the best decision for yourself. And remember that this is something that is a personal decision and you need to figure this out on your own. And depending on what your circumstances are, then it may be something that you can pursue or maybe a good investment for you. And remember also that every career has its ups and downs. And what matters most is finding a path that really aligns with your passion and your values. And if you want to learn more about investing, whether it's investing in yourself, in education, stock market, real estate, then you can give me a follow at Nurse Who Invests. I hope that this episode gives you an idea and help you, like weigh in the pros and cons of going back to school as a nurse practitioner. And if you find this helpful, please rate and review this podcast. And it will help Nurse.org reach more listeners like you and help you learn more about the advantages of being in this profession. So until next time, take care and keep exploring every possibilities that you can have in this nursing career journey.
Thanks for joining Nurse Converse, brought to you by Nurse.org. Help us grow by leaving a 5-star rating and review on your favorite podcast platform. Nurse.org supports nurses with career and education tips, life advice, and breaking news. Thank you for all you do and for being you.